Okay, now go, Chris.
Is skin only lupus likely to develop into systemic lupus, and is there anything people can do to stop this from happening?
For most people with lupus, it will go from the cutaneous to the systemic, usually about 90% of the time. And there's really not much one can do. Um, Sometimes the skin type will flare up after exposure to sunlight. So one thing they can do is try to minimize exposure to direct sunlight.
What can people do to avoid flare-ups?
Well, basically try to lead a healthy lifestyle. For example, um, as I mentioned, limit the sun exposure, use sunscreen when you're outdoors. If you have problems with cholesterol or other risk factors for heart disease, take a fish oil capsule and eat a low-fat diet. Um, if needed, lose weight. Those are some of the general things.
Is there anything people can do to prevent heart problems?
Um, it's kind of like what I just said, but the problem with lupus is it can attack almost any organ in the body, and sometimes you don't know if damage is being done unless you get some testing done. But again, eating healthy, low-fat diet, um, avoiding smoking, um, exercising regularly, those are important.
What treatments do you recommend and why?
There are a lot of different treatments. Some of them are to reduce the inflammation. There's different medications for that, including steroids. There are also other more specific medicines that are more recent, and usually those are prescribed by a specialist, like a rheumatologist. There's also medicines that are used to treat conditions like malaria that also are used to treat lupus. So a lot of it depends on how severe the condition is and what the patient's symptoms are.
How likely is this treatment to help people, and how would they know if it's working?
The treatment can be fairly effective. In the old days, a lot of people would die of organ failure from lupus, but now there's a good chance of going into a long-term remission. Remission meaning a condition where the symptoms are well controlled, and so people have a much better prognosis now, especially if they get the right treatment. And sometimes you can tell just by the absence of symptoms that the treatment is working, and sometimes testing like blood tests can help with that too.
Should they see a specialist if they got diagnosed?
Most of the time, seeing a specialist, usually it's a rheumatologist, is recommended because they know more about the latest treatments and the best way to manage lupus. Lupus is a very complex disease, and it's not easy to manage it, you know, even if you're a specialist, unless you really treat it on a regular basis.
How is lupus treated?
Well, in addition to the lifestyle changes that I mentioned earlier, there's lots of different medications. And again, it depends on how severe your condition is. Some of the treatments can be expensive, so it's very important that you're under the care of a specialist who can make the right recommendations so that your treatment is efficient and it's not causing any harm.
And is there a cure for lupus?
There's no specific cure for lupus at this time because it's such a diverse disease with all sorts of different manifestations. Treating the different symptoms or problems that the patient is having can lead to a long-term remission, but so far no cure.
Okay, thank you, Dr. John.
You're welcome.